Three words you hope you never hear. You have cancer. It's estimated that about 1.7 million new cases of cancer will be diagnosed in the U.S. this year alone. But after dealing with the diagnosis, what's the best way to approach treatment? Here to help us answer that question is surgical oncologist and author of In My Hands, Compelling Stories from a Surgeon and His Patients Fighting Cancer, Dr. Stephen Curley. Dr. Curley, thank you so much for being with us. I want to ask you, who encouraged you to write this book?
It was actually my patients who encouraged me to write this book. When I would see new patients, obviously frightened by a diagnosis of cancer, fearing for their own mortality, worried about the future, I would tell them stories of other patients who had faced similar situations, sometimes to provide them hope, sometimes to provide them a sense of connection, knowing that other people had gone through the same thing. And the way I constructed the book is each chapter is built around a virtue that I have seen expressed and learned from the patients.
So you mentioned hope as an important message. How do you give hope to someone who has a new cancer diagnosis?
There's two answers to that. One, you provide them with very earnest and realistic data. People, particularly in this day and age, frequently go to the internet and they read all sorts of statistics and studies, and they may come in and say, I just read something that my chance of living is only 12 months. And you say, look, you're not a statistic, you're an individual. And I have patients with the exact same thing you do who I'm still seeing 15 or 20 years later. Now, is it everybody? No, you have to be realistic. You cannot provide false hope. And the second component of it is many patients, when their cancer is progressing and it's clear they are going to succumb to their cancer, have a fear that they're going to be abandoned by the medical system because they think, and I've unfortunately had patients referred to me who say, look, they're telling me if you can't help me, nobody can. And I'll say to them, well, I may not be able to remove your tumor, but I'll be here. I'm not going to abandon you. If you have symptoms, if you have problems, I'll see you, I'll help take care of them, we'll help make that transition. So it's giving them hope that the system will be there, that an individual will be there to provide them care.